Hi guys, my name is Asad and today I'll be talking about drugs for bleeding problems. I'll be summarizing it and will try to make it easy for you to learn. Drugs for bleeding problems are often used in fibrinolytic states which arise after GI surgery and prostate removal. The main drugs are aminocaproic acid, tranexamic acid, protamine sulphate and vitamin K. So first we're going to discuss about the aminocaproic acid and tranexamic acid. So they are synthetic. Unlike protamine sulphate and vitamin K, which have natural sources, these are synthetic. They are orally active and they are excreted in urine. They inhibit plasminogen activation. So how aminocaproic acid and tranexamic acid inhibit the formation of plasminogen? They actually bind to Kringle domain of plasminogen and blocks the binding of plasminogen to your fibrin. So talking about the potency, tranexamic acid is 10 times more potent than aminocaproic acid. And the side effects of these drugs are they can cause thrombosis, muscle necrosis and seizure. So let's talk about protamine sulphate. It is not synthetic, it's natural and it's found in fish, germ and testes. It is positively charged. So it's combined with heparin and decrease heparin activity, and that's why it is used to as an antidote of your heparin. So the side effects of this drug include bradycardia, hypertension, hypersensitivity and dyspnea and flushing. So talking about vitamin K inhibits warfarin but not in a way like protamine sulphate does with heparin. It actually increases the supply of active vitamin K1 and inhibiting the effects of warfarin. Vitamin K1 can be given orally or IV, but these forms are preferred, and you can also have subcutaneous form, but it is not given, it is not preferred because of the fact that it causes hypersensitivity and your anaphylactoid reactions. And also it is not used when there is a sudden need or a very urgent need of your coagulation factors, because they are very slow and needed 24 hours to actually form the coagulation factors necessary. So if immediate your hemostasis is required, frozen plasma is administered. Thanks for watching.